Okay, so check this out. This is an LED UV flashlight. We just bought this right here. And I got my 2 masks right here. I want to show you how many particles and viruses I may potentially have on these masks. Take a look at this. This is a mask I got today at Yard House when I ate over there, and I forgot this mask. They gave me this. I don't know if you see it or not. All of those things could be particles, right? All of those. And look at all over the place. This is what's on my face, and this is the one I use and wash. Occasionally I wash, right? Check this out. You go over here, okay? It's very obvious. A lot is on it, right? Okay, so why am I showing this to you right now? Here's why. Because we just got word from Governor Abbott today, I'm in Texas, that we are required to wear masks at work. Now it's a requirement that we're supposed to wear masks. Unless if certain things, you have a breathing issue or certain conditions that you have, you're required to be wearing a mask, right? Okay, no problem. We'll go ahead and listen and wear the mask. When you're looking at all these masks, people are asking a lot of different questions. And I went out there and researched myself. I got some stuff I want to show you. We will look at how CDC and World Health Organization is telling us how to properly wear a mask. And I want you to tell me yourself while you watch this, when's the last time you wore the mask the way the experts are telling us to wear a mask? I even have a video of a doctor showing how to wear a mask. And this poor doctor is looking here first, then she looks here, then she looks. You can tell she has all the steps on how to teach us how to wear a mask. And she needs a step-by-step process on how to properly wear the mask. And then I'll give you some data here. But let's go through this here together. Okay, so first of all, how COVID-19 spreads. 2 different ways. One is the fomite transmission, which is what? I'm touching this stuff. Somebody came over here. There's particles. I touch my nose. Boom, I got coronavirus, hypothetically. The other one is respiratory particles that reach you directly. This is sneeze, cough, 6 feet, 3 to 6 feet. You cough, I get it. Oh my gosh. Then I have it. A couple of days later, I'm having symptoms. I may have coronavirus. No problem. Then they tell us there's 3 different masks to use, right? The lowest level masks are these. This is the cloth mask. You're seeing a lot of people using bandanas. Those work as well, but that's considered the cloth mask. Then it's these masks, which are the surgical masks, but they're not recommending that we use this because they want to save this for who? Doctors, nurses. And the last one is the N95 mask, which I don't have one here, but this is what it looks like, right? You got a lot of people contact me saying, Pat, I can get you 100,000. I can get you 5 million. Do you want to buy and sell this to some people? And here's what you got to do. Now, these are the masks that we're looking at. What the CDC is not recommending us to use are these, and they don't want us to use these. They want us to specifically use these. Now, even though they want us to use these, guess what they're saying? They're saying that their nurses and doctors cannot use these because these are not the safest. You and I can use these, but in hospitals, they can't use this. No problem. Let's go through this again, what they say next. So cloth masks is what they've been recommending to use. Cloth face coverings are recommended as a simple barrier to help prevent respiratory droplets from traveling into the air and onto other people through the person wearing the cloth face covering cups. Okay, you get the idea. This is called what? Source control. Surgical masks we already covered. We've already gone through what to do and what not to do. Now let's go through what CDC is telling us to do when it comes down to recommendation with coverings, right? Here's what they're saying. CDC recommends that people wear cloth face coverings in public settings and when around people who don't live in your household, especially when other social distancing measures are difficult to maintain. Or cloth face coverings may help prevent people who have COVID-19 from spreading it to other people, or coverings are most likely to help reduce of COVID-19. Fine. Coverings should not be worn by children under the age of 2 or anyone who has trouble breathing or is unconscious, incapacitated, or otherwise unable to remove the mask without assistance. Now watch this. Who should wear a cloth face covering? General public, again, same thing, 2 years old, COVID-19 spread, people on symptoms. Okay, so all this stuff, pretty much the same thing we're looking at over there, right? No problem. Now, I want to show you what Anthony Fauci, who the other day when Rand Paul called him out and he had his nice, I believe it was a Washington Nationals mask on, he dropped it, he put it back up, he dropped it, put it back up, which means if there are any particles on the table, he dropped and put it back up. This is the man who is the expert. He went like this and he was about to answer. He went like this. Then he went like this. You're not supposed to touch this thing. He not once reached out and said, okay, this is what you're supposed to do. It dropped. If it drops, okay, put another thing here and go back again. Watch this now. That's Anthony Fauci. Now, here's what Anthony Fauci said on an interview with 60 Minutes. I want to say March 18th or March 8th. Take a look at this.
Information surrounding face masks. Can you discuss that? The mask.
Fair enough. So that's Anthony Fauci, our expert, talking about how whether masks work or not, do we really need to do it or not. Now watch this. Now here's a video from someone who is with World Health Organization showing us how to properly wear a mask. Now watch this.
Mask. Clean your hands with alcohol-based hand rub. And people who have symptoms suggestive of COVID-19.
Here we go.
Before touching the mask, clean your hands with alcohol-based hand rub or soap and water.
Yeah. 20 to 30 seconds rub. Obviously, we all do 20 to 30 seconds. Soap and water, 40 to 60 seconds. I'm sure everybody does that. Holy moly. Yeah.
Inspect the mask for tears or holes. Do not use a mask that has previously been worn or is damaged.
Yeah.
Verify which side is the top. This is usually where the metal strip is. Identify the inside of the mask, which is usually the white side.
Yeah.
Place the mask on your face.
Okay.
Covering your nose, mouth, and chin, making sure there are no gaps between your face and the mask. Pinch the metal strip so that it molds to the shape of your nose. Remember, do not touch the front of the mask while using it to avoid contamination. If you accidentally touch it, clean your hands.
Okay, that's one of them, right? That's one of them. Now watch the next one here. So I'm not even, so if I touch it, clean your hands. Now, how many of you, when you go to a restaurant or place of business, how many of you guys have this with you in your pocket all the time? Okay, now, first of all, let's just assume that's not all the time, but fine. Some of you are saying, I'm doing it all the time. Great. Now, here's another one from World Health Organization. This was shot February 5th, by the way. Watch what she says. It's got a couple million views.
Medical masks like this one cannot protect against the new coronavirus when used alone. When you wear them, cannot protect against the new coronavirus. Medical masks like this one cannot protect against the new coronavirus when used alone. When you wear them, you must combine with hand hygiene and other preventive measures. WHO only recommends the use of masks in specific cases. If you have cough, fever, and difficulty breathing, you should wear a mask and seek medical care.
Sure.
If you do not have these symptoms, you do not have to wear masks because there is no evidence that they protect people who are not sick. However, if you are healthy, but you are taking care of a person who may be infected with the new coronavirus, then you should wear a mask whenever you are in the same room with that person. And remember, if you choose to wear a mask, use it and discard it properly, and clean your hands with alcohol hand rub or soap and water. For more information on mask use...
Okay, so here's the next one. Watch this. Now, here's a lady that does an exercise, which I just showed you here with the LED UV flashlight. Watch what happens right here. When this doctor is showing you how much viruses and particles can be in the equipment you're using. Now, watch this here. Check this out.
Powder represents our bacteria, our germs, and viruses. So we can demonstrate how easy it is to spread this, even if we're running into the grocery store with proper PPE and protective equipment and grabbing one item. Okay, I have placed my protective equipment on correctly, and now I'm going to run in and buy some water at the grocery store. So here's my water. I'm going to take my pen and pay for it. I got my receipt.
Yep. This is a great example, by the way.
Open this up. Get a drink. I've been shopping.
Very helpful. Takes a sip, puts it back up with your hands, which is what you do. How many times do you see your waiter going like this, pulling it down when they're talking to you?
And I am ready to take off my mask and gloves. And I want to show you how important it is that we do this in the right order, in the right way. So let's see how I did. I'm going to turn on my black light here. Oh my goodness. So starting off, we knew it was on the one surface. Look at my gloves, my mask, right here on the outside of my glove.
How are you protected with these masks?
Oh my goodness, look at this pen. The poor person who uses this pen after me. Oh, and look at my hands. Oh my goodness, the worst part about this is when I remove my mask, I did not use the proper procedure, which means that must be on my face.
How many people are using the proper procedure, right?
Getting in your nose and in your mouth. And now this is really close to my nose.
Okay, so now watch this. So let me show you the other one. Now here's a doctor showing how to properly use it. Watch where she's looking at the, I'm gonna speed it up a little bit and just look at her eyeballs, where she's looking at the entire time.
On your face. The mask on the outside is considered dirty. Don't pull your mask below your chin while you're wearing it and have it sitting down here. It should always be fitting properly on your face. Third thing, you don't want to have the mask down. You don't want it sitting like this.
Yep.
All of these are going to create opportunities for cross-contamination of yourself or other surfaces.
Script.
I want to cover a few simple steps to keep yourself and others safe while wearing a mask. When you first go ahead and pull out a mask, we want to make sure we identify which side of the mask is the outside of the mask, because the outside of the mask, again, is dirty. Here at the hospital, we're marking the outside of the mask with our initials. When you at home, you may choose to do the same. Or you could put something like a star, some type of mark identifying that that's the outside of your mask. As you can see, it's the same color on both sides. So that's going to identify that that's the outside of our mask. The second thing, whenever we're taking our mask off, we want to make sure it's put into some clean type of area.
Of course, we carry a carton with us everywhere we go. Absolutely. I'm sure you do all the time.
What we don't want to do is put it in an area that's not clean. An area that's not clean would be something like our purse or our pocket.
Yes.
So I am going to go ahead and put my mask on. So to put my mask on, I want to pull it down, make sure it's covering under my chin, make sure it's covering my nose, and make sure it's nice and secure. So again, I'm not going to touch the outside. I'm not
Look over here, Karen.
Okay? I need to now remove my mask for whatever reason. First thing I'm going to do is clean my hands. So I'm going to perform hand hygiene. I can do that with soap and water or hand sanitizer. When I remove my mask, I'm going to do that from a clean area. So I'm going to remove my mask from the ear loops. I'm going to inspect this mask to make sure I can reuse it. So has my mask been compromised at all? Is it wet? Is it visibly soiled? If it is, I want to go ahead and I want to throw it away. I would then go ahead and perform hand hygiene.
Here's the point I'm trying to make you with this case here. Obviously, she's a doctor. This thing's got 600,000 views. It was uploaded 2 months ago, and it's got 600,000 views. And it's coming from an expert, but even the expert needs cue cards for her to remember what to do next. And you and I are not the experts. And they're telling us to go use something like this. And when you put the light, LED light on, look at the amount of particles. And worst thing that we do. So let's just say you go to the restaurant. Let's just say you're in the market. Let's just say you're doing whatever you're doing. You know what's proving that this thing doesn't work? You know what proves that this thing doesn't work? Let me give you an example right here. So say I put this on, okay? Here we go. Let me do the responsible thing here. All right, so we got this here. At this point of the game, it's been on the table. God knows what's on the table. We keep this place pretty clean. But I take this. I put on my face. You ready? All right, here we go. So, hey, what's going on? Okay, great. What can I get you? I'd like to get a drink. You know what is it that you wanted? I can't do that. That's not something you can do. Now, yeah, okay, babe. So how was your day today at work? Okay, it was great. What was it? Yeah, okay. Oh, hang on one second. Oh, it's Dad. Hey, Pop, what's up? Boom. Yeah, okay. Yeah. We'll see you on Saturday. Yes, sounds good. You want me to pick you up something? No, great. All right, you ready? Pow. All of this stuff that's on this thing here. Then a phone goes right here. Are you carrying one of these things with you when you go to the restaurant? So then, phone sets, another call. Hey, bro, what's going on? Dude, are we going to watch a basketball game together? Yeah, bro, absolutely. We'll watch it together on Sunday. Okay, great. Put it down. Third time. Eat the food. Touch everything. Drink. Blah, 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 blah. Great. Okay, thank you so much. You cut the pen. They bring the pen. You don't know where the pen's been. You sign the pen. You put this on your face. You grab your phone. You leave. What is this protecting right here by doing that? What is this protecting right here? Now, I understand the one part about coughing. I understand the one part about me giving it to you because of 3 to 6 feet social distancing. I'm fully with it. I totally understand. We go by every single guideline that the state tells us. Every time CDC makes some changes, we go ahead and do it ourselves. Right now, great. So the mask thing, I don't know. Fine. Let's say we follow the mask. Let me take it a different level for you. Here's some data. Here's some data for you. Okay, let's look at some data. Let's look at some data. So every news you're listening to, cases are up. We got to be careful. It's the second coming of coronavirus. Look at this. Oh my gosh. Look how high it's going. Look at the numbers. 52,609 cases yesterday, right? Cases. It's all cases. But we're not talking about how many people died yesterday. Watch this. It's okay. 670 people died. Do you see how this thing's going down? This is positive, right? That this thing's going down. But when you go to cases, this thing's going up. Cases going up. And then you see here, that going down. Okay, what does this really mean? Let me break down the numbers for you so you know kind of what this really means. Okay, so far, if yesterday we had 52,609 cases, okay? 670 people died. If we do the math on this, 670 divided by 52,600, that's about 1.2%, which means 1.2% of people that get COVID-19 die. Or is it really the number? Let me go a little bit further for you. Total count is 2.74 million people in America have had COVID-19 case. 130,000 people have died. That's 4.7%. But if you go worldwide, 10.7 million people have had the case, coronavirus. 516,000 people have died, which is what? 4.8%. If it's 4.7, 4.8, and now it's 1.2, shouldn't we be celebrating? Shouldn't we say good news? Percentages are going lower, which means what? It's not as deadly. This is basic math I'm showing you. Now, some people may say, Pat, you're manipulating the numbers. Tell me why. Because the way you need to do it is take the death today, which is 670, and go to the amount of cases that was 2 weeks ago. Fine, let's do that. This is what? 670 people died what? As of July 1st, right? Okay, I have 670 here, 670 here. Fine? Okay, so if I go to cases and it's July 1st, 14 days ago is what? Let's go to 14 days ago will be what? 16th? 23,047, which is what I have here. If I take 670 divided by 23,407, it's still 2.9% lower, which means it's still going lower. This is somewhat of a celebration, but that's not how the media is pitching it. So let me even take it a different level when we're doing basic math. Here's the math. So when you look at these numbers and they're saying cases are so high, cases are so high, what happened all of a sudden with cases being high? Well, Washington Post does an article on what date? This is Washington Post. Let me find it. Washington Post. I don't know if you see it. WashingtonPost.com, right? Investigations on CDC date June 8th, which is less than 4 weeks ago. Less than 4 weeks ago. What do they say here? Investigations. This is not like somebody just wrote this article here, right? CDC wants states to count probable coronavirus cases and deaths, but most aren't doing it. Okay, let me read it one more time. CDC wants states to count probable coronavirus cases. So now, let's find out what CDC defines probable coronavirus cases. So let's go to the CDC website, which is right here. What is a COVID-19 probable case? A person meeting clinical criteria and epidemiologic evidence with no confirmatory laboratory testing performed for COVID-19. Let me read it one more time. So a person who goes and meets with the proper doctor, but there is no confirmation that they took a COVID-19 test that came out positive, none. A person meeting presumptive laboratory evidence and either clinical criteria or evidence, a person meeting vital records criteria with no confirmatory laboratory testing performed for COVID-19. So now, Washington Post, CDC wants states to count probable coronavirus cases, which means how many of these cases that we're getting are probable cases and how many of them are just cases that we have. You know, it's real. I don't know. You probably have it. You know how you go to a doctor. I remember 6 years ago, I lost my voice for a couple months. I went to the doctor, 3 doctors. They said, there's a lump here. You probably have cancer. You probably have cancer. You probably have, 3 of them said, you probably have cancer. I went into surgery. They cut. It's benign. You don't have cancer. Probably have cancer. Cut it. It's benign. You're good. I left 4 weeks. I didn't have a voice, but it was probably I had cancer. So you probably have coronavirus. You probably have coronavirus. That's kind of the same thing that we're talking about here. If you look at this data with cases, 52,000 what? 609. Here's my question for you. Out of the 670 people that died yesterday from coronavirus, God bless their soul. I am sure families devastated with the loss of a loved one. We right now have people in our sales force that have coronavirus that have been hospitalized, and I'm going through it with them on the call to see what they're going through because I want to hear the challenges they're facing, and they've both recovered. We've had many of them that have recovered in the field, and we had a couple of them here that had to recover as well, and they'll be going through it themselves. So I want to know what the symptoms are. I want to know what they're feeling. I want to learn myself, and I want to do whatever I can to protect everybody. But here's a question I got for you. 670 people died from coronavirus yesterday. How many people you think died yesterday that we don't know was because of coronavirus? Let me ask the question one more time. How many people do you think died yesterday in America who died from coronavirus, but in the registry, they didn't put coronavirus? What do you think the numbers? Most likely 0. Why? Because when people are dying right now, hospitals are pretty much required to go and find out if this person died from coronavirus or not. If they did, they say cause of death, what? Coronavirus. But I got a different question for you. You ready? Out of the 52,609 cases yesterday that got coronavirus, here's my question for you. How many people do you think right now have coronavirus that are sitting there saying, man, I went to CVS, they told me wait, I'm not gonna wait, forget about it, I'm gonna go home. I think I got a flu or a cough. It feels like it. I feel like bronchitis maybe. I don't know, it just doesn't feel good, but I'm not gonna go to the doctor and I'm not gonna get tested. Let me ask the question one more time. How many people you think, at 52,609 yesterday, got a case of coronavirus, how many have it that haven't gotten tested because they just didn't want to go to the doctor? Twice as much? 3 times as much? Let's assume you said 3 times as much. If it's 3 times as much, that means that 52,609 really was what yesterday? 156,000. If it's 156,000, you know what it tells us to our 1.2%? That 1.2% goes to 0.4%. That means the death rate is really 0.4%, not 1.2%. You know that number, the 2.9%? That 2.9% goes to what? 0.9%. because it's a third, which means at the beginning when they said this is 3%, 3% of people are dying. Oh my gosh, 5% of people are dying. The math is not probable math that they're doing. So if you look at everything combined together, I am not telling you don't wear masks. I'm wearing masks because I'm following guidelines. At the office, when everybody comes in, we're doing temperature with everybody on their forehead. Nobody comes into the office until they go through the temperature. We're following every single thing that is taking place with the guidelines. But here's what's a deeper concern for me that we're not talking about. The deeper concern for me is the fact that 45 million people lost jobs. Cirque du Soleil just filed bankruptcy. A bunch of businesses that you and I use have to file bankruptcy because they can't sit around hoping they're going to be able to last. Are we doing the right thing right now with so much more fear of round two? So many people that are conventions. I do events every year in Las Vegas. Every single people I talk to in Las Vegas with conventions, hotels, they're struggling. So many hotels. Is it Blackstone that missed the payment on their first hotel business that they bought? They missed the payment. Blackstone missed how does Blackstone miss a payment? This is not a small little company we're talking about. It's one of the biggest companies, respected company, missed payment. Check this out. Blackstone skips payment on $274 million hotel loan. What do you mean Blackstone skips payment? Blackstone is supposed to be like Premier. They're skipping a payment? Yes, they're skipping a payment. Why are they skipping a payment? Who the hell is going to a hotel right now? Who's going to a hotel right now? Some of the best restaurants here that we would go to, they're just telling me, Pat, we can't afford it anymore. These are high-end restaurants shutting down. Is that exactly what we want? Is it really what we want? So look, Fauci, if you're going to tell us wear masks 1 minute, and a couple months prior to that, you told us masks can't do anything, why are you telling us now? If it's just something to say, it's going to make you feel better and it's going to make people feel calmer, fine, we're doing it. But I also know a lot of people that are not feeling comfortable wearing these things. I also know a lot of people that are putting this on saying, man, I can't even breathe right now. I'm not feeling comfortable about it. I also know a lot of people that are putting this on. They're getting a lot of anxiety. So what is the solution? I don't know. All I can say is we need our leadership team to really start considering every single person and look at the data a little bit more and stop using this data here to manipulate everybody and put fear into us and start thinking about the small business owners that 59 million Americans work for. These are not billionaires. These are small companies with less than 500 employees that 59% of you, 59 million people in America work for. If those small business owners go out of business, what could come next? Crime? Things that are really, really scary. I mean, you saw the other day when a guy that was marching, protesting across a person's home, you saw the guy that came out with the pink shirt and the gun, the rifle, and you saw the lady who's a lawyer, both of them pistols she's holding, and later on they came and said, we're so sorry, we're Democrats, we're not trying to say anything, don't take anything away from us, and they kept our law license. What is going on with all this stuff? By the way, this is nothing on how ugly it can get if people are hurt economically. And if you want to find the solution being printing more money, which Nancy Pelosi is saying, let's send $10,000 with families with 3 kids, I also don't think that's the solution because you're putting us in more debt and the dollar keeps going lower and lower and lower. And guess who's going to have to pay the price for this long term? So again, these are data. These are numbers. I'm simply showing you stuff that I looked at. You're going to have to make up your own mind on what you want to do. But I'm hoping more people will start sharing information like this and start questioning everything. Am I imposing anything in this video? The only thing I'm imposing in this video is question every politician, every expert, everybody out there because they're making big decisions for you and I to sit there and say, you cannot go to work. Your kids cannot go to school. People got to stay home. And there's so many traumatic things that are happening to the existing generation, the kids, that we're not going to see the side effects of it for 10, 20, 30 years from now. But we're going to feel it. So we have to start thinking that way. We can't just sit there and say, well, look at some of these percentages. So what are your thoughts? You saw some of the numbers I shared with you. What are you thinking about this? Comment below. I want to hear from you. And if you want to have a real dialogue with some of your peers, share this with people you know and see what they're telling you about this. Having said that, thank you for watching, everybody. Take care. Bye-bye.